She sat down. The first thing she said to me is, why are the nurses having such trouble with giving me these pain medications? And she said, why are they acting like I'm seeking drugs? And I told her that I didn't know. Like I said, I had never taken care of someone with sickle cell before. The only thing that I knew from books was that when you're in sickle cell crisis, it hurts quite a bit. And that you should have pain medications, because if you don't get your pain adequately controlled, it's going to just hurt worse and create more of a problem. So Heather first sat down and started talking to me about her experience with this and how she tries to stay out of the hospitals and how it really irritates her that people think that she's coming in for IV pain medications. So that's when I sat down to her and said, why don't you tell me your story? Tell me about when you were first diagnosed, when you were a kid. And that's coming from being the pediatrician in me. Why don't you tell me your whole story all the way through? And she told me her whole story, and she said how she is in a severe pain and she tries to wait it out at home, and that, like I said, it really upsets her when she comes to the hospital and people think that she's not in the kind of pain that she is in. She also talked to me about different friends that she had that had sickle cell and their different experiences at different hospitals, and it was a real eye-opening experience.
How so?
I just had never heard that doctors, to be honest with you, would be so judgmental. I mean, I guess I know doctors can be judgmental, but to hear it from somebody and to say how much it hurts their feelings that doctors are judgmental and make they have stereotypes and preconceived notions about when people come in and what they're asking for medications. It really upset me that as a profession we don't do a better job. So the stereotypes I was being specific to is there are different pain medications, IV pain medications, that are used when people are in serious pain. And often people are labeled as drug seekers or coming in to request these pain medications. And sometimes people doubt whether or not people are actually in enough pain to require these pain medications. Doctors do not do a good job of assessing someone's pain, and we don't do enough talking to the person to actually see whether or not that person is in pain and whether or not they do require this. I think that if we would sit down and talk to the person, we would realize that we probably grossly underestimate somebody's pain and that we should be a lot more willing to give pain medications. What happens is the nurse, she was saying that the nurse did want to give her the pain medications, and then the nurse typically pages the doctor, and then the doctor is supposed to tell the nurse what to do. But I just decided to get up out of my chair, go see Heather, talk to Heather, find out whether or not I thought she was in pain, and I thought she was in pain, and I told the nurse to give her pain medications as I had written for them. Well, when I say different stereotypes or how people don't actually adequately assess people's pain, that doesn't just apply to doctors, that applies to nurses too. And I mean, I'm sure the nurse doesn't like me changing what they had thought, but at the same time, I sat down and I told the nurse too that I assessed her pain and that I thought she needed the pain medications, and that was my professional opinion.